Welcome to an essential overview of encephalitis, covering its causes, symptoms, and critical treatment strategies. Encephalitis is a severe medical condition that requires rapid identification and intervention. Let's start with a clear definition. Encephalitis is defined as acute inflammation of the brain parenchyma, which is the actual brain tissue itself. It's important to differentiate encephalitis from meningitis, which is inflammation of the protective membranes. If both the brain tissue and membranes are inflamed, it's called meningoencephalitis. The causes of encephalitis are varied, but the most common culprits are infectious agents. The most common and serious cause of sporadic fatal encephalitis is the herpes simplex virus, or HSV-1. This virus has a predilection for affecting the temporal lobes of the brain. Other viral causes include arboviruses, transmitted by mosquitoes or ticks like West Nile virus, and the highly lethal rabies virus, transmitted via animal bites. Another growing category is autoimmune encephalitis, where the body's own immune system mistakenly attacks the brain, such as an anti-NMDA receptor encephalitis. Symptoms usually develop over hours to days, and the clinical presentation is key to distinguishing it from less severe infections. The hallmark symptom that distinguishes encephalitis from uncomplicated meningitis is an altered mental status, presenting as confusion, disorientation, drowsiness, or even coma. Like many infections, fever and headache are common. However, seizures are also highly prevalent due to direct irritation of the brain tissue. Patients often show focal neurological deficits, such as weakness on one side of the body, or hemiparesis, or speech difficulties like aphasia. Especially with HSV encephalitis, patients may exhibit severe behavioral changes, including agitation, personality shifts, or hallucinations. Diagnosing encephalitis relies on a combination of laboratory tests and advanced imaging. A lumbar puncture is crucial. CSF analysis typically shows lymphocytosis, which is increased white blood cells, and a normal glucose level. Polymerase chain reaction, or PCR, is the gold standard for detecting specific viral DNA, such as HSV DNA, within the spinal fluid. MRI is the imaging modality of choice. In herpes simplex virus encephalitis, it characteristically reveals inflammation or hyperintensity, specifically in the temporal lobes. Management is time-sensitive, and prognosis is highly dependent on how quickly treatment is initiated. If HSV encephalitis is even suspected, IV acyclovir must be started immediately and empirically, as any delay can lead to permanent brain damage or death. Supportive care includes managing seizures with anticonvulsants, controlling intracranial pressure, and ensuring proper fluid and electrolyte balance. The prognosis for encephalitis depends heavily on the cause and the speed of treatment. For HSV, rapid diagnosis and treatment are absolutely vital.